So we're going to talk to one of the medical doctors who's licensed to use your program, Dr. Shafipour. Right now, Dr. Shafipour, welcome to the program.
Thank you, Randy.
Now, this program, you've been using it for how long?
I've been using it for approximately 3 years.
And you love this program?
Oh, absolutely. Yes,
okay.
I do.
How are you using it, and what are the results?
Well, I use it for basically, I'm a family practitioner. I see a wide range of patients that are diabetic, pre-diabetic, high cholesterol, heart disease. And I use it to get people off of their medications, give them quality of life, and reverse a lot of their chronic conditions.
You have a celebrity clientele.
Yes, yes. I used to work for the motion picture medical group, and there we saw a lot of people that had SAG insurance, that had directors guilds, and I used the program on them very successfily.
What kind of results are you seeing in your practice?
So the best thing about transformation is the education that patients get. Patients go, so the program, as you know, is broken into several parts, and the initial part of the program is an elimination diet. You get all the allergens eliminated out of the diet. That's when people usually normally feel better. A lot of their chronic conditions, chronic fatigue goes away because we're taking away a lot of foods that in our diet that cause allergens. And so once they go off of that, a lot of the chronic fatigue, a lot of the conditions that they have immediately goes away, and they have to weigh their food. They have to look for food that cause this, and they really get educated on how their body feels with different foods, how their body reacts. Diabetes, as we know, blood sugar is extremely elevated. Diabetics have insulin resistance. Their body doesn't respond well to insulin because of the effect that high sugar foods have on their blood sugar. So with this program, with the elimination of a lot of foods that cause that elevation in the blood sugar, when those are taken away, then suddenly the pancreas has breathing room. Suddenly the insulin starts working, and I've seen dramatic results. I've seen someone who has been on 40 units of insulin daily, suddenly they go to none. Suddenly blood sugar starts going down, and I wean them off of insulin, and they feel very well. And not pricking yourself obviously is a great quality that they gain back. So with a lot of the meal replacement type diets, HCG diet, you're on a fixed amount of calorie a day that is provided by that company, or but with the HCG you're on a 500 calorie diet. So you will lose a lot of weight on the program, but once you get off of the program, there's no education involved. During the course of the program, there's no education. You're just following a meal plan, and then once you're on your own, a majority of the people gain the weight right back because they don't know their body. They haven't learned their allergies. They haven't learned how their body responds to different food. And majority of the time, they yo-yo back up, and they're off into the next shake. They're off into the next program. Basically. With the transformations, again, the best part of it that I talk to patients about is the education. You go through the list of foods. Then when you go on the transition program, you learn what your food allergens are. You learn what causes weight gain, what causes weight loss. And when I did the program, what I learned about my own body is that rice doesn't do well. Culturally, in my culture, rice is a huge part of our diet, but I noticed that if instead of a big plate of rice, I go through a little plate, I feel a lot better. I don't have bloating. I don't have a lot of the chronic fatigue symptoms that I used to have.
Tell us more about how you're using this in your practice.
So we actually got a lot of dramatic results. One of my most successful patients was a very famous director who he was hypertensive, he had liver disease, fatty liver, and he went on the program. The main reason he went on the program was he wanted to feel good. Directors, as you know, they work very long hours. He was doing 5-6 espresso shots a day and was very tired, very fatigued. When he went on the diet, he felt so well. His goal was to lose about 30 pounds and reverse a lot of his conditions. But the biggest benefit that he got was the condition that the program put him in and that's a fat-burning condition, gave him so much energy that he got off the espresso shots, he got off the medications that he was on, his blood pressure normalized, and he basically got quality, and everyone around him at the show, at home, everyone could see those results and benefits.
Dr. Shafipour, thank you for coming on the program.